Okay, everyone. So, talking a little bit about the emergency medical technician at Queensborough Community College. Um, as you know, we have an EMT program. Um, this was the wrong. Times are a little different. Daniel Armstrong is the administrator of the program. I'm the main instructor. And you probably have a little idea of what EMS is about just by seeing things on the street, emergencies, whether they be medical or trauma, um, emergency childbirth. You know, we live in an age where you kind of assume that anytime there's an emergency, somebody having a heart attack, somebody involved in a motor vehicle, somebody not breathing, you call 911 and an ambulance shows up in a relatively short period of time. But that really wasn't always the case. You know, the fire department has about 250 years of history and experience. Police department, relatively the same. EMS is only about a little over 50 years old. See, there was no real coordinated ambulance services. You know, back in the day, in the late 50s, when my father was a teenager, he lived in Brooklyn. One Saturday morning, he was up having breakfast with his family and his older brother, my uncle, and his mother started complaining of a very severe headache. She was only in her late 40s at the time, and she went to rest in her bedroom for a little while. Dad, his brother, his father continued breakfast, hung out for a little while. They went to check on his mother, and she was unconscious on the bed, twitching, drooling at the mouth. There was no 911 to call. I don't even think they had telephones back then when my dad lived. What they had to do, they had to run to the family physician's office several blocks away, tell them what was going on. The family physician came to the house to see what was going on, only after he had finished what he was doing. And at that point, after seeing my paternal grandmother, did he wind up using a neighbor's phone to call the hospital and have an ambulance sent over for my grandmother, which at that point was really too late. Really not 100% sure what was going on, but the way they described it to me, she probably had a severe hemorrhagic stroke, bleeding in her brain. And probably wouldn't have been anything to do for it anyway, but it would have been nice to know that she could have gotten to that hospital a little bit faster, because in a lot of situations, time does make a difference, and proper care on the scene does make a difference as well. So as far as our class goes, this is the textbook that we use. There's some required equipment as well, but we'll go over that a little bit later. You have to have internet access. You have to have some equipment. This is, like I said, Daniel Armstrong is the administrator. I'm the lead academic coordinator. A gentleman named Kevin Rummel is the skills coordinator. The normal class that we run is Mondays and Wednesdays from 6 to 10, and Saturdays from 9 to 6. Not sure how it's going to play out in the spring with online learning, but hopefully we're going to work something out. We also try to run a summer class as well. It's an accelerated class. It runs Mondays, Wednesdays, and Fridays from 9 to 6. And it stretches from right after Memorial Day to the middle of July. And upon completion of this class, you're eligible to sit in and take the New York State EMT exam. Again, we'll talk a little bit about what being an EMT is like. Now, this class is credited for 9.5 college credits in the Department of Health, Phys Ed, and Dance. 9.5 college credits. It used to be 8 credits, but because the national standards have increased over the years, we had to add on a lot more hours, a lot more training, and a lot more clinicals. And among that time, so altogether it's about 220 hours of training. And among that includes 2 12-hour shifts on a 911 ambulance through the Northwell Hospital EMS system. We're very fortunate to have that clinical affiliation. A lot of EMT programs fulfill their state clinical obligation by just putting you in an emergency room or somewhere to observe. Emergency rooms usually just kind of put you in the corner and have you change bed sheets or bedpans or maybe take a blood pressure. I think the real better clinical experience is to actually be on that ambulance, just like you're preparing to do in real life. let's talk about the EMS service to begin with. So EMS is a relatively new profession, but it has its roots over 200 years ago, even further. The first real dedicated EMS systems were developed in the military, specifically in the French armies under Napoleon, whenever that was. I'm not much very good on my history. Where surgeons on the Napoleonic army developed means of transporting and treating wounded battle soldiers on the field. Many more advances came into EMS through the military. Back in the turn of the 1800s, most ambulances were privately run by horse. That's not me on the ambulance, by the way. Horse and carriage. That's a nice picture of an old hospital out of Kings County Hospital in Brooklyn. But it really was about World War II when real advances in emergency medicine started taking place. In the pictures that I showed you before, ambulances were usually staffed by either a nurse, a resident physician, and maybe a couple of orderlies to do all the grunt work. What you see in this picture here is an Army corpsman delivering medical care to a wounded soldier on the battlefield. And this is really the first time during World War II when you had a non-physician, non-nurse, very highly trained technician administering medical procedures to someone else in the field. It took some time for the civilian world to catch up to that, but it was really an idea. And then we started developing means of transporting and treating mass casualties from one area to another. And incidents like the Korean War developed things like mobile army surgical hospitals. Anybody knows about that sitcom back in the 70s, MASH, where they kind of pick up and move the hospital from site to site. And another important innovation was the use of medevac helicopters for transport of wounded. What you see here is technology that was developed for NASA in the 50s called telemetry, which was used to, from a distance, monitor astronauts' heartbeats and vital signs and all other things going on. And that technology was actually incorporated into our EMS systems when it was developed. Most ambulances back in the 50s or 60s were just kind of converted hearses because these were the only type of vehicles that could accommodate a patient in a lying down position. But it wasn't until about the mid-60s when the Department of Health and Sciences published this paper called Accidental Death and Disability, the Neglected Disease of Modern Society. So most of the medical community was focusing things on such as cancer and heart disease. But what was happening in 1965? Well, 20 years out from World War II, the country was in one of its most affluent times economically. So a lot more people were owning and driving motor vehicles, and a lot more interstate highways were being built with a high level of traffic. Now, the cars back in the 60s did not have all the safety features that they have now. And so what you were seeing is, among other things, a lot of death and a lot of morbidity from really bad car accidents. So much so that the incidence of trauma had really skyrocketed at this time. And not only were all these severe injuries a problem, but EMS systems were very random. There was no consistent training. Most ambulances just consisted of two burly guys in a white coat with a stretcher that would pick you up, throw you on the stretcher, and drive really fast to the hospital. Well, if you were involved in a major accident, it was shown that sometimes just doing that could cause more harm than good. That it was a much better idea to provide some sort of dedicated, competent medical intervention on the scene and stabilizing that person before transport to the hospital. And that's where the concept of pre-hospital care came from. Back in the early 70s, this television show on NBC came out called Emergency, which is, I remember from my earliest days begging my parents to let me stay up and watch, go figure. And but it was really cool because in a time where most of your TV series were either sitcoms or shows about police stories, this was the first series that kind of built around these two Los Angeles Fire Department paramedics. And the lots of these shows really circled around medical emergencies, and it really brought to the public attention what EMS is all about. Kind of interesting, this actor here, Randy Mantooth, he's still around. They both had to actually take realistic paramedic training before being cast on the show. And this guy is still a trained paramedic. He's very, very active in the field. He's very, very active in the politics of the field. He's a great guy. Actually met him once. So again, what is EMS about? EMS is about providing pre-hospital or out-of-hospital medical care. It's not just about scoop and run. That's why it's a heavy load of intense training. And EMS is not just about ambulances and EMTs, but it's about the care that's provided on the scene. It's about the interaction with the emergency departments. Emergency medicine itself is relatively new. Back in the 60s and 70s, most ERs were staffed by either internal medicine physicians or surgeons that were basically moonlighting from their own practice. So ERs were not as adequately staffed or equipped as they are today. And now we know that the nearest hospitals are not always the most appropriate hospitals. There are specialty hospitals that EMTs need to learn about, such as trauma centers, somewhere where you take a patient who's suffered a severe injury, someone who's suffered several gunshots or a high velocity motor vehicle accident may not fare well at the nearest community hospital. You need to take them to a dedicated trauma center where they have trauma surgeons, imaging equipment, and are specially trained and researched in the field of trauma. Burn centers are specialty fields. Burns are some of the most horrible injuries that can ever occur to someone. When somebody succumbs to a severe burn injury, it's usually not the burn itself that kills them. It's the secondary complications, the infections, the loss of body fluids, electrolyte problems, end organ failure. And these hospitals have units specifically designed to help treat that. Pediatric centers, such as Cohen's over in New Hyde Park. If you learn a little bit more about medicine, whether you go into the field or not, you'll learn that children are not small adults when it comes to medical or trauma. They have different anatomies, different physiology, and they respond to injuries and illnesses much different than adults do. And it's a whole field of medicine in and of itself. What's been up and coming lately over the last 20 years are stroke centers, hospitals that are specifically designed to handle stroke. Stroke is basically what we call a brain attack. If you go back 25 years, if somebody were to suffer a stroke, the damage was done. Once it occurred, there was nothing that could be done. You would wish them the best of luck in rehab. Certain interventions have been developed from the late 90s on that if a person has a stroke and it's picked up quickly and they're transported to the appropriate center, it could actually treat and reverse and cure the stroke before permanent damage has occurred, but only if many factors are put into play. Cardiac catheterization centers are pretty important too. So if you wind up taking the EMT class, or we talk about it in first aid class, again, if somebody is having an active heart attack, they're clutching their chest, they're complaining of chest pain, they're sweating. Let's use two hospitals in Queens, for example. Mount Sinai, Queens, and Astoria, Elmhurst Medical Center in Elmhurst. If the ambulance is maybe 5 minutes away from Astoria and 8 minutes away from Elmhurst, you would think that would be better to take them to the closer hospital. But no. Most of the times, with what's going on, it would be better to take them to Elmhurst, which is a little bit further, but has the specialty care that can adequately treat this heart attack. Most communities access EMS through the 911 system, but there are still some communities that don't have a 911 system, that they have to dial a dedicated 7-digit number to get access, but that's changing. And again, there's all sorts of professionals that EMTs deal with: physicians, nurses, other health professionals like physician assistants, local law enforcement, NYPD, state and federal law enforcement, state troopers, I mentioned fire suppression, social workers. Really have to network with a lot of different professionals, and a good EMT will really pick the brains of all the different professionals that he interact with. So, so as far as what's the difference between an EMT and a paramedic, some of you guys may have that question. There are different levels of EMS training. EMT is one, but the most basic level of EMS training is actually called emergency medical responder. It used to be called first responder. Emergency medical responders are trained in advanced first aid. They are certified by the state. They're usually people who initiate care but do not transport to the emergency room, such as firefighters in New York City are trained as certified first responders. Could be park rangers, could be lifeguards, it could be camp counselors. Minimal, I shouldn't say minimal training, moderate amount of training, but no, they cannot independently staff an ambulance. The minimum level to do that is the emergency medical technician, which was what we teach at Queensborough, only called EMT Basic. Emergency medical technician, you're going to learn a lot more techniques, but you're also going to be responsible for transporting that patient to and from the scene to the hospital, or even from hospital to hospital. I'll talk about that in a few minutes. Advanced EMT, formerly known as EMT Intermediate, has a little bit of extra training. They're trained in more things like IV insertion, advanced airway training, not recognized in New York City, the 5 boroughs, recognized elsewhere. And there's starting to, in some states, actually phase that out in favor of the highest level of pre-hospital EMS, which is the paramedic. Now, if you like being an EMT, you would love, absolutely love being a paramedic. As a paramedic, you are pretty much bringing the emergency to the scene of the emergency. Paramedics are trained in IV insertion, advanced airway insertion, EKG application and interpretation. They're responsible for 40 to 50 very powerful, life-saving, serious medications, drugs, and they really, have to think on their feet and respond on a dime to changes in that patient's condition. They are the ones in charge of that cardiac arrest, that heart attack, that seizure, that asthma attack, that gunshot wound to the head. So it's just something to consider. I myself have been a paramedic for over 25 years. And even though right now I'm on a little hiatus from it as I got small kids at home, it's something that I've always loved and I will go back to doing on a volunteer basis once I have a little more time to do it. That's just me. So what are some of the things that the EMT does, the roles and responsibilities? Well, cardiopulmonary resuscitation is a big one. And if you look at this slide, we're not doing CPR in a big open classroom. We have all the space available in the world. Where's most CPR being done? It's being done in a crowded kitchen corner, or in the bathroom between the toilet and the bathtub, or on a subway platform, or on the rooftop of a crack house, or in somebody's basement. Bottom line is the EMT's got to be ready for every situation. That's why we really emphasize the importance of CPR, because unlike the hospital or nursing home or any other inpatient facility that you work in, you don't have the luxury of having extra staff and backup to guide you through. A lot of times it's just you and your partner. And you got to know what to do, and you got to know it flat. Defibrillation is another important skill. Used to be that EMTs weren't even doing that, but defibrillation, just like CPR, the sooner it gets to that patient, the more chances that patient is going to have of a successful resuscitation. Rescue and extrication from motor vehicles, properly moving a victim so as to not aggravate any spinal injuries. There's certain methods, certain techniques to do that rather than just yanking them out. Assessing vital signs and observing trends in that patient's condition by learning about vital signs and what they mean. Medication administration, again, used to be very, very seldom would an EMT administer medications. When I was my first trained as an EMT, I would think there was about 3 medicines that the EMT was allowed to use. Now there's up to, some states, up to 12 to 15 different type of medications. And very important part of the training. You see right here is an EMT, looks like he's administering an epinephrine auto-injector to somebody having a severe allergic reaction. Bleeding control is obviously a very important part of the job, so you gotta have a little bit of a strong stomach. Treatment, proper treatment and splinting of musculoskeletal injuries. One of the most important things you'll have to learn about as an EMT is proper documentation. When you go to a doctor's office, half the times you're swamped in paperwork. They're jotting down notes because they want to see what's going on from the previous visit. Your notes are going to be read by the ER, and they may even make it all the way up to the ICU, the CCU, and any rehab facility that patient winds up being transferred to. And it also protects you in a court of law when people try to sue you. That's a whole talk in itself. Even though this is kind of an old school technique, as I said, proper immobilization of the spine and extrication from the vehicle. And before you think of EMS as all death and disaster and scary stuff, there are some pleasant occasions, like facilitating or assisting in the delivery of a newborn. I gotta tell you, within my career, I think I've assisted in the delivery of about 12 babies, spanning my whole career. My teacher, Dr. Linda Joseph, who taught me to be an EMT, 35 years in the field before even me taking the class, never delivered one. My wife has been in the field for about 7 years now. She's still waiting for her first one. Kind of funny though, when I witnessed the birth of my own child, I almost passed out, but I guess that's just a father thing. And really, it's not much to it, just if you know what to do. As I mentioned, there are many, many medications that have to be studied and learned. And medication administration is something that has to be done right. You put a splint on wrong, you can take it off and redo it. If you don't bandage a wound properly, you can do it over. If you inappropriately give a medication, that cannot be undone. The effect is there. So that's something that really is stressed. I don't know, I just love this picture. That's why I put it in there. If you ever saw the movie Return of the Living Dead, 1985, you know exactly what I'm talking about. So what are some qualities that an EMT should demonstrate? Well, some attributes, as we say. Well, for one thing, an EMT should be in semi-decent shape. It is physical work. You're going to be running up and down stairs. You're going to be carrying people. You don't necessarily have to be a bodybuilder or triathlete to survive in this field, but you do need to take care of yourself. You need to watch what you eat. You need to get some regular exercise, take care of yourself, and and don't fall into that habit of the EMS diet. You need to be your patient's advocate. You need to be non-judgmental. You need to check your biases at the door. You're going to be treating anybody of different races, different ethnicities, different political beliefs, different sexual orientation. And if you have a problem with dealing with anybody whose lifestyle is different than yours, may not be the best field for you to get into. You should not reserve judgment for anybody. And when your patient is sick in front of you, last thing you want to do is preach to them what they should be doing with their life, the fact that smoking is what's causing their chest pain, or the high-risk activity is what's causing their head trauma. That's not for you to do. Your job is to assess and treat and learn from your patients as well. So this is a little crazy. Wow, all I did was smash my finger. Victims. So this EMT obviously looks a little overzealous, but a good EMT will always do more than less. Will do what they think is above and beyond for their patient, rather than taking shortcuts for expedience. As an EMT, you need to know what your roles are and what your duties are. You are not law enforcement. You are not combat training. But at the same time, you should always be prepared for any medical emergency that you're arriving to. Your oxygen tanks need to be filled. The batteries in your defibrillator need to be charged. If you don't bring the proper equipment up to the call, you're basically useless as an EMT. So you got to be prepared. An EMT always has to be able to fill the blanks, solve the mystery. We can teach you a ton of medical training, but you're always going to have that one call that wasn't in the textbooks, wasn't in the protocols. And you're going to have to pretty much figure it out, improvise, adapt, and overcome. That's one of the hallmarks of a good EMT. The best EMTs are the ones that give back and share what they've learned over the years, that are involved in the educational process, whether it be in the classroom or in the field. A good knowledge of the human body is imperative. I mean, maybe not to the level of a hospital pathologist or a trauma surgeon, but you need to know where your organ systems are. You need to know what compromises what. You need to kind of know what goes where. So where can you work as an EMT? I'm sure everybody is kind of wondering about that. There's several things you can do. A lot of our graduating EMTs go and work for the city 911 system that's overrun by the fire department of New York. For good or for bad, the fire department doesn't really start you out at a very good salary. I think starting salary for an EMT is about $33,000, $34,000 a year. Doesn't seem like a lot, true, for a full-time job, but if you look at the benefits of working for the city, you have pension. You can retire after 25 years. Sick time, vacation time, overtime, medical insurance. Especially in these days, that's something really important. For my full-time job, to get family coverage medical would cost me about $1,200 a month, and that's considered good. So luckily, I'm on my wife's plan, who works for Fidney, and she pays $5 a month. It covers the whole family. You can't beat that. Dental, good luck getting a good dental plan. And that's just a few of the benefits. The ability to qualify for free paramedic training if you commit to 3 years on the job. They have a program for that. That's how I did my paramedic training. I took the exam, I qualified, I signed the contract, took the paramedic training with the agreement that the loan would be paid back as long as I put in 3 years in a job. Hey, to have a job for 3 years, it's not a bad deal. You can work at some private voluntary hospitals, things like New York Hospital Queens, Flushing, Northwell, Jamaica. A lot of these hospital systems have their own EMS departments. Some of them are contracted to do private EMS transports with certain companies and certain clients, and some of them are contracted into the city 911 system. So when you do your clinical rotations at the Northwell ambulance, the ambulance that you'll be riding is contracted to work in the 911 system. So you'll be doing emergency 911 calls. One of the benefits about working for the private hospitals is that you can work maybe full-time, part-time, per diem, meaning on call, whatever the need arises. Some pay good, some pay adequate. It really depends. There's no one size fits all, but there's more flexibility. A lot of EMTs wind up starting for private commercial ambulance companies. You may have seen these in the field, like Senior Care, Richmond County, Hunter, just to name a few. These ambulance companies are for-profit services, so they're businesses whose job is to provide medical transport. They do some emergency work, but if you have a patient that's in a hospital and needs services that a hospital cannot provide, they need to be transferred to a different hospital. If you got a patient in Mount Sinai, Queens, who needs to go to a cardiac catheterization center because they need that intervention, ER can't just throw them in a taxi cab and wish them the best of luck. They need to put them in a certified, competent medical transport unit. And that's where a lot of the private ambulance companies come in. They're contracted by the hospitals to provide those in-facility medical transports. When I was a young man, I used to do a lot of freelance EMT work for the YMCA. I used to stand by for karate tournaments and gymnastics meets. And people in charge would pay me up to $20, $25 an hour, sometimes a little more, just to stay there and be there in case there was any injuries. Real easy way to make money. And don't blow off the idea of volunteering. I know in today's economy, it's kind of difficult to put in and commit time to doing something that you're not getting a paycheck for. But if you don't have any job or professional experience, if you're just starting out in the world and you want to put your name out there, volunteer work always looks good on a resume. It's always going to put you in front of somebody else with all else being equal. Has anybody ever applied for a job and they say, well, do you have experience? No, I was hoping to get experience. Well, how do I get the experience if I don't get the job? Volunteer. And even if you don't volunteer for EMS, always think about some type of volunteer experience, especially if you're going into some professional medical fields like physician assistant, physical therapy, occupational therapy. They want to see that on your application. That's just a little free, friendly advice. And there's just a list of different volunteer ambulance corps in the area. EMS has evolved so much over the last 20 years that we have EMTs and paramedics writing our own textbooks, where it used to be just physicians from the American Academy of Orthopedic Surgeons. We have our own EMTs and paramedics doing research and literature searches and making changes in the field itself. We're becoming much more self-sufficient than we have in the past. Public health initiatives are a component of EMS as well. Standing by for influenza vaccinations, disease surveillance, blood pressure clinics. What's an up and coming thing going on now is called community paramedicine. The patient is discharged from the hospital with the diagnosis of something called congestive heart failure. And I'm just throwing that out there as an example. If they go back to that hospital within 30 days with the same diagnosis, that hospital does not get paid for that visit. So one of the advantages of community paramedicine is to, kind of like the family doctor making a house call in the old days, going by, stopping by that patient's house, seeing how they're doing, evaluating their vital signs, checking their medications, checking their wounds, things like that. And it's really important field to try to keep people out of the hospital as well, which are, as these days are completely overcrowded to begin with. So a little bit again about our EMT program at Queensborough. It's intense. I will not lie about that. There are several exams, several quizzes, skills evaluations. It's about 80 hours of classroom work in the books, 80 hours of skills time, not to mention your 2 clinical rotations. You basically almost have a quiz every day. You have about 8 major written exams. You have homework to do. You have assignments to do. You really, and for every hour that you're in the classroom, think you're going to probably about 2 or 3 more hours to study. You can't do it alone. You'll learn at the first day, you're going to need to interact with classmates, make friends, and see each other through. Form study groups, form bonds, get each other through that. But those are habits that will carry through with you for the rest of your life, whether you go to paramedic school, medical school, police academy, fire academy, or any other field that you go into. I've had students come back 10 years later telling me that the habits they learned in this class really prepared them for other aspects of life. So not that I'm trying to toot my own horn, but I think we run a pretty good show here. We consistently get a very good pass rate on the state exam. And once you become certified EMT, you can do any of those venues that I talked about. I'll stand by if anybody has any questions, any interest, just something to think about. Oh, maybe I should. All right, so if nobody has any questions, I will sign off, and you can always email me if you have questions later on. I will go over the exam in a few minutes, or maybe a little bit later, and then um, if you have any questions regarding the material